In today's video, we're going to be talking about dental health. Now, that might not be something you'd expect me to talk about on this channel. However, it can have a lot to do with health and quality of life for those with Alzheimer's disease and related dementias. So we'll be talking specifically about periodontitis and then give some hints and tips that you might be able to use to support your loved one with dementia in maintaining dental hygiene. Welcome to today's episode of Show Me the Science. The American Academy of Periodontology describes periodontitis as inflammation of the periodontal tissues resulting in clinical attachment loss, alveolar bone loss, and periodontal pocketing. In other words, periodontitis is gum disease. So you might have heard of gingivitis. This is kind of the next stage that could occur if gingivitis isn't treated. It's important to go ahead and acknowledge here that this isn't my area of research or specialization, and I'm not a dentist, so everything that I'm going to be talking about with you today was gathered from other sources. I'll be sure to cite those sources and put links to them in the description of this video. Older adults are actually at higher risk for gum disease or periodontitis, and periodontitis is associated with an increase in inflammatory markers and a decrease in anti-inflammatory markers. With Alzheimer's disease and related dementias, inflammation is just not a good thing. A 2016 study by Ida et al. Looked into presence of periodontitis among a sample of 60 individuals with mild to moderate Alzheimer's disease. They wanted to investigate whether there was an association between presence of periodontitis and cognitive decline. They reported that their study showed in Alzheimer's disease, poor dental health, and in particular the presence of periodontitis, is associated with a marked increase in cognitive decline over a 6-month follow-up period, independent to baseline status. In other words, no matter the extent of cognitive decline when the study began, they found that presence of periodontitis was associated with greater cognitive decline 6 months later. Now, this is just one study, and the authors do note that while systemic inflammation might be involved, the full relationship between periodontitis and cognitive decline isn't yet fully understood. However, I do think this speaks to the importance of dental hygiene for older adults, especially those who are living with or at risk of Alzheimer's disease and related dementias. And that brings us to our hints and tips. So if you care for an individual with Alzheimer's disease or related dementias, you probably already know that giving a verbal cue like "you should brush your teeth now" might not be enough to actually get them to initiate the task. What could be more effective is visual cueing. So if they're getting ready for the day in the morning, simply setting a toothbrush and toothpaste in front of them so that they see that it's there and they can figure out what to do. Better yet would be if you went ahead and brushed your teeth right then and there when you're hoping that they do the same. That way they can see you doing it. You're cueing them on how to go through the motions of brushing their teeth thoroughly, how long to do it, etc. You might also want to talk to your dentist about whether or not they should be using a manual toothbrush or an electric toothbrush pending their needs. When deciding that, also take into account their dexterity and arm strength. So if an individual has difficulty holding something small, a manual toothbrush might be a little bit more difficult. Or perhaps it's hard for them to hold a heavier toothbrush like an electric toothbrush. You want to make sure you're personalizing this to their needs. Finally, consider your loved one's sleep-wake cycle when deciding when you want to cue them to brush their teeth. Many of us brush our teeth at least twice a day, if not more, in the morning and then at night before we go to bed. But your loved one may be awake and asleep at different times of day than most of us are. So you might want to take that into account and maybe shift their dental hygiene schedule to match their individual needs. Thank you for watching today's video. I'm Dr. Julie Fietta. As always, I'd like to remind you that this is intended to be informative and maybe spark conversation, but it is not intended to be medical advice or recommendation because I'm not that kind of doctor. Thank you for watching. Please like, follow, and subscribe.